So how approval of apalutamide, enzalutamide, and soon to be approved darolutamide is going to change the treatment paradigm for our patients. We did not have anything to treat our patients with in this setting, and we just waited for them to have metastasis. And now we have these three drugs, and not surprisingly, apalutamide and enzalutamide are already a part of NCCN, AUA, American Urology Association guidelines, and they're already approved. And same will happen with darolutamide. As soon as it is approved, we will see darolutamide being a part of these guidelines. So our patients have three exciting drugs which have minimal impact on quality of life. In fact, quality of life improved on these trials when they were treated with these agents. So we'll have these options available in our clinic. We have two new drugs now which will be added to the treatment arsenal of castration-sensitive metastatic prostate cancer. And these will include enzalutamide and apalutamide, direct, novel, specific androgen receptor inhibitors. And now how it is going to change the current treatment paradigm. So let's take a step back and see what we are using right now. The two classes of drugs which are currently approved for our patients for their castration-sensitive metastatic prostate cancer include, number one, docetaxel chemotherapy is a chemotherapy, and most of my patients have no enthusiasm to receive chemotherapy. Chemotherapy has its own side effects, complications we are all aware of, require concomitant steroids, and have meaningful impact on quality of life. So that was one option, and that is one option. And the second option is abiraterone or Zytiga, which requires concomitant steroids for many months to many years. So these are the two current options we have. And now come enzalutamide and apalutamide. And these are both drugs which do not require concomitant steroids, which are not associated with complications of chemotherapy. So I think approval of apalutamide is going to be a very welcome option for majority of my patients who are not interested in chemotherapy, who are not interested in long-term steroids, and who want to preserve their quality of life, as we saw in the Titan trial. So now with availability of apalutamide, we have this option of an oral pill. Patient can just take the bottle of the oral pill from their doctors and use those pills by themselves without having to worry about so many side effects.